At a time when Albertans have given birth to a record number of babies, in 2008, 50,543, expectant mothers in Banff are facing what to them seems a crisis. It has been reported that the Mineral Springs Hospital is considering an indefinite suspension of obstetric services. To the Minister of Health, over 70 women are expecting babies in the next 5 months in Banff. The lack of planning by this government is directly affecting a core service. What is the Minister's response to these citizens?
The Honourable Minister of Health and Wellness.
Mr. Speaker, it is correct that the Alberta Health Services Board has issued a statement that said there would be a temporary closure of obstetrical services at the Banff Hospital, strictly related to the fact that the staff that are required, the decision was made that the hospital was not adequately staffed. They have attempted to recruit staff. The decision was made that for safety reasons there would be a temporary suspension of obstetrical services, and should be noted that services are supplied at Canmore, which is some 15 minutes away, Mr. Speaker.
The Honourable Leader.
Well, thank you, Mr. Speaker. Indeed, there are services available beyond Banff, but has the Minister considered the extra burden on an already overburdened system of delivery in Canmore and also in Calgary?
The Honourable Minister.
Well, Mr. Speaker, both facilities are quite capable of handling the extra cases, and I think that it's somewhat of a stretch to call a 15-minute drive a crisis situation, Mr. Speaker. I would suggest that there are many places in this province that would be very happy. Residents of this province would be actually quite happy to have to only drive 15 minutes to services, Mr. Speaker.
The Honourable Leader.
Well, Mr. Speaker, without obstetric services, many physicians will stop providing other services in the community. They will move to a community where they can provide the services they're trained to deliver. What is the plan, Mr. Minister?
The Honourable Minister.
Well, you know, Mr. Speaker, I don't understand where this particular leader, how he could make that statement. He's basically coming up with a premise that something is going to happen, that there is no evidence that it's going to happen. You know, it's typical fear-mongering.